FCPS is a crucial step for medical professionals seeking specialization in their respective fields. Here in this video, we will try to guide you. You will also learn the appropriate preparation process. Understand the exam structure. First of all, familiarize yourself with the format and structure of FCPS exam. Complete your synopsis during the first 6 to 8 months of your training. The dissertation should be started immediately after the approval of synopsis. It has been observed that trainees who delay and do not take this seriously, they face difficulties at the end. Study materials. Utilize standard textbooks, clinical guidelines, and reputable authentic online resources relevant to your specialty. Stay updated with the latest medical literature. Multiple choice questions help in maintaining interest in preparation for the theory exam. Clinical exam. Preparing for the FCPS clinical exam in Pakistan is a rigorous process that requires dedication, structured study plans, and appropriate clinical knowledge. Mostly students fail in this exam as they have no idea how to prepare for this exam. A clinical exam is different from theory exam. In clinical exams, examiners can easily assess your training, your clinical skills, hard work, and experience. After observing you in clinical exams, examiner decide whether you are safe doctor or not. Start early. Begin your preparation well in advance. Know the number of stations, type of cases you may face, and the time allotted for each station for clinical exam. Focus on core clinical knowledge relevant to your specialty. Make a routine of taking detailed history and examining at least one patient daily during training. Ensure a strong foundation in basic medical and surgical principles and recent advancement related to your specialty. Immediately consult the book if you face new and interesting cases during your training period at FCPS. Develop clinical skills. Practice clinical skills regularly. This includes taking patients' history, performing physical examination, and refining procedural skills relevant to your chosen specialty. Clinical rotations and practical experience. Engage in clinical rotations and gain practical experience. Exposure to patients produces long-lasting effects on brain and it increases experience. Mock exams and practice sessions. Participate in mock exams during the training period. Communication skills. Clear and concise communication with patients, colleagues, and examiners is crucial if you want to pass the clinical exam. Practice patient counseling scenarios. Feedback and improvement. Seek feedback from mentors, senior colleagues, and those who have successfully passed the FCPS clinical exam. Develop effective time management skills. Allocate the time appropriately for different stations during the exam, ensuring you cover all aspects of each case. See videos of examination techniques on YouTube and follow different sources. Stay updated with exam changes. Be aware of any changes in exam pattern, content, or guidelines. Stay connected with official communication from the College of Physicians and Surgeons. Extra duties. Do not perform extra duties during the training period. Join study groups or discussion forums with peers preparing for Fcps clinical exam. Final review and revision. Never delay the final exam and try to take the exam immediately after completion of training. Plan a comprehensive final review and revision closer to the exam date. Focus on consolidating your knowledge and addressing any weak areas. Remember, success in FCPS clinical exam is not only about knowledge but also about clinical judgment and effective communication. Tailor your preparation to your specific specialty and seek guidance from mentors and experienced professionals. Best of luck.